I genuinely don't understand why more doctors aren't talking about this. Tadalafil has been quietly making waves in the biohacking and longevity community. And when you look at what the research is actually showing, way beyond what it gets prescribed for, you start to understand why. Today I'm going to cover the cardiovascular and longevity data, why you should seriously consider starting this much earlier than you think, what it actually does to protect your penis as you age, yes, including shrinkage, and for the men already taking it who aren't getting the results they expected, I'm going to show you exactly what to combine it with and why that changes everything. Let's start with the numbers, because these stops me cold. 2 large-scale studies, one with 8,000 men, one with over 500,000. Men taking a low daily dose of Tadalafil showed a 34 to 44% lower risk of dying from any cause. Heart attack risk down 27%, stroke down 34%, dementia 25 to 32% lower. And the dose that produced these results? 5 milligrams a day. Now here's where it gets interesting for younger men. A leading urologist I came across recently was asked at what age a healthy man should consider starting Tadalafil. His answer was 40. Not because anything is wrong at 40, but because 40 is when you should start protecting what you have. And what does that protection actually look like? Think of your penis like a muscle that needs regular blood flow to stay healthy, flexible, and functional. When blood flow decreases over time, which it does as testosterone naturally declines from around 30 onwards, that tissue doesn't just underperform. It can actually shrink, become atrophied. This is penile atrophy due to age, and it is far more common than anyone talks about. Tadalafil keeps those vessels open, keeps that tissue oxygenated. Think of it as maintenance, the same way you'd maintain any other part of your body you actually care about. And it goes well beyond that. In men with metabolic syndrome, daily Tadalafil improved insulin sensitivity and produced around 4% lean muscle mass gain. It improved testosterone to estrogen ratio. It lowered markers of chronic inflammation. These are not small side effects. These are meaningful systemic benefits from a drug people treat as purely sexual. And the brain. Large database studies show a 25 to 32% lower risk of dementia in men on Tadalafil. The anti-inflammatory effect appears to play a significant role, reducing the kind of chronic, low-grade inflammation that silently damages cognitive function over years. Now, for the men watching this who are already taking Tadalafil for ED and feel like it's not working the way it used to, or not working the way they expected, I want to talk about why that happens and what to do about it. Tadalafil works on the vascular system. It improves blood flow. But erections are not purely a vascular event. There is a second pathway that Tadalafil does not touch, and that is the brain's arousal pathway. This is where apomorphine comes in. Apomorphine works centrally, directly on the brain, not on blood vessels, not on tissue, on the neurological signal that initiates arousal in the first place. When you combine apomorphine with Icarin, which supports nitric oxide production and blood flow, and Tadalafil, you are hitting 3 completely different mechanisms simultaneously. This is exactly what the BraveRX formulation does, and that is exactly why the results are so different from Tadalafil alone. With over 65,000 men currently using it, and close to 1,800 5-star reviews, it is genuinely changing the ED landscape. If you're currently on Tadalafil alone and not getting the results you expected, you should seriously consider switching to this formulation. And if you're thinking about starting for the first time, these are exactly the kind of licensed online doctors you want to be speaking to. The entire process is online. No waiting rooms, no awkward appointments. It arrives straight to your door. Use my link below for a discount and free shipping. Tadalafil is one of the most researched, most underutilized compounds available to men right now. The longevity data alone makes a compelling case. The penile health data makes it urgent. And combined correctly, it performs at a completely different level.